and gentlemen, the next topic is biofunctional dentistry, the missing link to overall health, and this will be taken by Dr. Samir Nayyer, ladies and gentlemen. Dr. Samir Nayyer is transforming lives through ozone therapy in Jalandhar, Punjab. In the bustling city of Jalandhar, Dr. Samir stands as a prominent figure in the world of biofunctional dentistry and medical ozone therapy. With over 16 years of dedicated practice, Samir Dental Care and Oxy Hill Clinic has been instrumental in helping countless patients regain their health and vitality. And we are honored to have you here with us. Dr. Samir, please put your hands together for the gentleman, everyone.
Good morning, everyone. So, thank you, Dr. Sanjay, for giving me this opportunity to speak about biofunctional dentistry. That is the totally different thing you will be hearing today. So basically, I started biofunctional dentistry in 2016. Before that, I was practicing regular dentistry. But something changed my mind because I was suffering from migraines and cervical issues and acid refluxes. But I wanted to find the real reason. I used to take 1 or 2 painkillers every week. So I wanted to find the real reason behind this. So I tried to search different things. I tried few medications for that. My colleagues who are so-called specialists, they basically diagnosed me with the migraine. And they asked me to take painkillers and different types of medications. I won't comment on that. So I didn't want to take those medications. My father is having medical store. So we were used to take medicines from our childhood, like you can say our candies. But whenever we have something, we just take medications for that. So basically, then I searched for myself and found that there is one discrepancy in my alignment. My one canine was just tilted inside, and that is basically causing the migraine and cervical issues. Then it took me around 3 years. I think I started in 2014, and my treatment was completed in 2016-17, and it took me around 3 years to find out how to correct that canine, to synchronize that canine in harmony with my other teeth. So Dr. Sibia, you recently heard, he explained me that search precedes research. So no research is possible without search. So if we want to find something, we are finding something on Google, or we are finding some articles of something, then we are actually searching what has already been searched. But you will find few things in my PPT that you won't find anything in our web world. So 50%, I would like to say that 50% of your problems in your body, they are because of your teeth. So I won't waste much time. So basically, I practice biofunctional dentistry. Biofunctional dentistry is the combination of biological and functional dentistry. Now, biological dentistry, we basically look beyond just treating our teeth, just filling the cavities, just cleaning and all that. But we take we take care of the relationship of each and every tooth and the supporting structures and this relation with the body. We take care of, our main focus is on our oral microbiome and the metal fillings. So whenever you chew your food, if there is an imbalance of bacteria in your oral cavity, like if you have anaerobic bacteria in your cavities, in your gums, they will go with your food. So whenever you chew your food, those bacteria, they will go with your food to your gut, and that causes gut dysbiosis, and many problems are related with the gut dysbiosis. Also, I would like to tell that the metal fillings, the mercury fillings or other metal things that are present inside your oral cavity, like the mercury will release a lot of trillions of vapors. So I'll share you a link for that also. Now, what is functional dentistry? So basically, biological dentistry is a treatment, a holistic treatment without chemicals or minimal chemicals. But functional dentistry is about focusing, balancing the forces on our teeth. So basically, this is the real root cause of any problems in the body. Means if you are having cavities in your body, I'll show you how. I'll try to explain that also. So whenever you chew, whenever you touch your teeth, whenever you clench in an anger, in stress, and if you are not sleeping properly, you are clenching your teeth, your means if the alignment is proper, you won't get bad signals in the body. But if the alignment is not proper, the forces on each and every tooth is not balanced properly, then definitely that particular tooth will send signals to your brain to work awkwardly. So every nerve that from every tooth is going towards your brain. There are a lot of nerves, they are being connected to your brain. So basically with the neural pathways, these teeth can manifest different pains in your body like your migraines, cervical pains, lower back aches, sciatica pains, knee joint pains, ankle pains. You can even have acid refluxes as well in your gut. So basically, this is a tooth organ relationship chart. This is a meridian chart. So I would request the team of Dr. Sanjay to share the link of this video, of this presentation. You don't need to click the pics. I'll ask them to send this complete presentation to you. That is why I made this presentation online. So basically, each and every tooth is linked with particular organ. This is tooth meridian chart. Tooth meridian means we have meridians on our fingers, on our feet, on our ears. There are a lot of, the body is really interlinked with each other through these meridians. We try to balance these forces and infections on particular meridian to help the body to get rid of the problems they are having. So we not only consider the oral cavity as such, but definitely we see that a mirror image of your body. So whatever bacteria that are present inside the gums, they go with your through your bloodstream to the body, to your system, or they can also go with your food to your gut, like already I explained that. So there are many studies, they show that your heart diseases are related because of your bacteria in your periodontium. So basically, caries, कीड़ा लग जाना दांत में, this is very common. So my Brahmastra is ozone. I use ozone, medical grade ozone in my dental treatments everywhere. So we try to arrest the caries with ozone therapy. We do ozonated ozone insufflations, and I also give ozonated oils to the patients to do the brushing with ozonated oils rather than using toothpaste or any medicated toothpaste as well. So this caries, I was able to sustain it for around 1 year. Why 1 year? Because this caries was detected in my colleague who used to come in to my clinic. She was having this caries, so I could take care of her daily. I was not giving ozone insufflation daily, but for few days, continuously for 5 days, then once a week, then once a month. But she was using ozonated oils, and her caries is still at the same levels. I have already checked with IOPs as well. So mercury fillings, they are a big hawks in the market. Everyone wants to know about mercury fillings. So I have a complete video, in-depth video, where I explained each and everything about mercury fillings. You can scan this QR code and you can get the complete detail of the mercury fillings and its ill effects on the body. So basically, we have protocols to remove, biological protocols to remove mercury filling, and we use bis-GMA-free fillings which are biological compatible with your body. They are biological safe. Biological dentistry, we extract tooth biologically. Biologically means normally why it's different from regular extractions. We basically extract the tooth, completely debride the socket, and then we use ozone insufflations, like this is the infected root canal. So basically, you can see there is a lot of infection inside. So your immune system is continuously busy to remove these bacteria from your body, to fight with these bacteria with your body. So when we extract this tooth, we not only just extract the tooth, we also debride this area completely. We also debride this area completely mechanically. We also give ozone insufflations and a lot of ozone saline washing. Then we also give ozone injections also, just to disinfect this cavitation, this area completely from the microorganisms. So this patient came to me from Bangalore. She consulted few dentists in her area, but everyone was giving her antibiotics. She was suffering from many gut issues, and she took around 3 to 4 months to get back to normal with the functional medicine approach. And she didn't want to take any antibiotics. So she contacted me. She traveled to Jalandhar from Bangalore, and she stayed for, I think, 4 days with me in Jalandhar. We gave ozone therapy to her, medical ozone therapy. We also did biological extractions. We did remove her mercury fillings biologically and replaced with the more biocompatible materials. She didn't take any antibiotic. No antibiotics, not even a single pill of antibiotic. She also took just one painkiller at the night of extraction, just to sleep properly, just precautionally. But she came to me twice a day for next 3 days to get the ozone therapy. We also give systemic ozone therapy as well as intraoral ozone therapy. So generally I don't do root canals at all. Means it's 2016 when I left doing root canals. But in case I need to do root canals, before 2016 I used to do almost 50 to 70 root canals per month. But till now, after 2016, that number has not even crossed 20. But even then, for those 20 or 15 root canals, what I did, we use ozone therapy in that. Means that will take a long time. I am here to tell you the prevention first. These are the treatments. Biological dentistry is based on treatments only. So today I'll let you know how to prevent those problems. Yes, you can ask me later, I'll definitely tell you. So this was a thing, my favorite subject, TMJ disorders. TMJ is the real victim, not the real cause. Basically, our teeth, when they are not aligned properly, they basically hurt our TMJ or temporomandibular joint disc. That basically initiates cascades of problems in the body. So like if your car is not balanced properly, if you don't check your balancing of the car, there will be, from the starting, you will feel that there is an imbalance, there is echoing noises in the car. But if you don't take care of further, then the alignment of your complete car will be gone, and that will definitely impact your suspension. So here your wheels are your teeth, and your suspension is your TMJ, temporomandibular joint. So basically this is a connection between mandible and your C1, C2. This is how your muscles basically, whichever muscles are attached on the mandible, your chewing muscles, they are attached to some other bone as well. So whenever there is any discrepancy in the muscles of the chewing muscles, then there will be any discrepancy in other muscles as well. So basically here I want to tell you that now I will explain you about functional dentistry. Means every dentist will tell you कि भाई कीड़ा लग गया तो उसकी filling करनी पड़ेगी, root canal करनी पड़ेगी, or now biological dentists are saying you'll have to extract that. So I will try to explain how basically caries occur. So our teeth are designed to bear the forces on one half of the tooth. Our back teeth are designed to bear the forces on one half of the tooth. Like this, you can say on A part. But if there are forces on B part, second half, due to any discrepancy in your occlusion, discrepancy or any jaw alignment or any trauma or anything, reason could be anything, they will develop micro cracks in the tooth. Means in the center of the tooth, where enamels from both the halves join, you will see the micro cracks here. Basically, here bacteria grows. This is not the thing that if you will eat sugary foods and if you will eat processed food, the caries will develop. No. Definitely, those foods, your sugary foods or sticky foods or your processed foods, they will accelerate the growth of bacteria over there. But they are not the real cause of that. So basically, the bacteria will grow down like this and reach your root canals. You can see in this picture, this tooth is designed to bear forces on this half only. But where you see these blue lines, that means these lines are not wanted on this tooth. That is why the caries developed on this half. So there are 2 points where micro cracks can occur and caries can develop, one on the top and one on the side. So patient comes to me, they are having severe pain or sensitivity in the tooth. If I check them clinically, their teeth means we see they are really sound. There is no problem in their teeth. But when we do the X-ray, the caries develop here. So basically these micro cracks, they develop because of the imbalance of the forces. So you have heard from many speakers from yesterday and today also that we are basically energy and we need to balance our energy. Each and every cell of our body that works on energy. So we need to balance the energy everywhere. So most of the times oral cavity or teeth, they were not considered anything in our overall health. But now I have seen a lot of patients getting this treatment. Now you can see there is little discrepancy. You can't say the teeth are very small aligned, nothing like that. But patient had to go for multiple fillings. He's having mercury filling as well. First this filling, then this filling. Means there are a lot of fillings, one after the other. But if you can see, you see one more, this dislocation. So if you are basically having one cavity as well, you must go for alignment, because to prevent for further getting caries in other teeth as well. So you want the solution, na? I am a very big fan of Zakir Khan, a stand-up comedian. So I really like his saying ke bhai aaya to bata ke jayega, hold on. So we basically check how to basically prevent these problems. So basically our team is trained to check you with proper gadgets and everything like this. So we use aligners, clear aligners for doing the treatment. We don't use braces now because they are also metal thing and biologically they are not good for your mouth also. So we use clear aligners. Our clear aligners technology is little bit different. We not only work on your front teeth only, just to give you a good smile, but yes, we also work on balancing the forces on your back teeth also. We try to bring the maximum balance of the forces on front as well as back teeth. Or we do full mouth rehabilitations when the crowns, you have worn out crowns, we can't raise the bite, because there are a lot of problems if your teeth are treated. So this is sleep apnea. This is normal breathing, whenever we lie, whenever the space for tongue inside the oral cavity is enough, then don't have any obstruction in our airway passage. But because of any malalignment issues or attrition of your teeth, when the space for tongue reduces in the oral cavity, and when we lie down to sleep, the tongue obstructs the airway passage, and that creates sleep apnea or obstruction, and you get up at night like this, just wanted to breathe in more air. So generally we do it with aligners, and then if required, we do it with your crowns or minimally invasive treatments. So basically we not only work on the interior aspect of our oral jaw, but on the posterior aspect also. Basically we try to expand the jaw to give more space for your tongue to relax in the oral cavity. So this is a patient, I think they have not connected the audio, but you will hear about her problems and how we treated with the teeth. She was having, she started company of digital marketing in 2014 in Noida. And she used to do my temporomandibular joint digital marketing. So for a few months, she did it for me, but suddenly I stopped hearing from her. She stopped replying her. Then I called her husband, what has happened. He told me that she is having a lot of issues in her alignment of her body. Whenever she gets up, she thinks that she is falling on her right. She has left her company. Even many problems were coming, and they have got all the brain MRI scans from JP Hospital in Noida and different hospitals here. But she is not getting any relief from that. But she was taking 7 to 8 tablets a day just to make her sleep. Just to make her, they were giving, I think, some tranquilizer or some sleeping pills, other sleeping pills, so that she won't feel any problems. Then I asked him to come to Jalandhar, get a consultation with me. I'll check if something is missing in her teeth or some problem is coming in her teeth. So they drove to Jalandhar next day, and I checked her teeth, and I gave few balancing points on her teeth just to check whether she will be able to get rid of these problems or not. The next day, when she got up, she was feeling much better. She stopped taking all the medications from that day only. Then we did treatment. She used to come to me to Jalandhar. It took around 1.5 years to get her complete treatment done. And after 7 years, she is completely fine. She even forgot what problems she was facing at that time. That was done this was one of my first few cases only. I did it in 2016. No, you don't need to clap unless you will hear what she wanted to say. So basically, we try to make the balance in the body. That's it. So I would like to give you a few home remedies that you can do, that you can practice daily just to take care of your teeth, and so that you can have better oral cavity. You should brush your teeth twice a day. You don't need to brush your teeth very hardly. You just need to polish your teeth. You don't need to put more pressure. You don't need to clean the teeth. You just need to polish the teeth. And what I would recommend is use a circular motion. Just count 20 circles on every tooth, up, back, lower, all teeth, 20 circles on every tooth. And try to use non-medicated paste. Even I use ozonated oils for brushing rather than using any other paste. Yeah, they are the best thing. You won't put pressure on your teeth with electric brushes. So this is water flosser. I would definitely recommend to each and everyone. If you can't take anything from my PPT, just take this thing. You should definitely buy a water flosser, and you should definitely use this type of machine before sleeping every night. Details will be, you can check from Amazon. There are a lot of companies now, they have come up with water flosser. I used to ask my friends to get it from abroad because they were not available in India earlier, maybe 15 years back. So you can also do oil pulling. You can use any organic oil for about 10 minutes. You can rinse you can just keep moving it from this side, that side, keep rinsing. That will help to lower the bacterial load of the gums. That will also help your muscles of mastication to relax. No, not at all. No, sir. You can use normal saline water, salt water, instead of glycerin. I won't recommend that. Even if you can use ozonated oils for brushing, they will get similar effects. So you can do lukewarm water, salt water rinses also after every meal or whenever it's possible. Yeah, you have to drink enough water because that will help your saliva to flow, and your saliva is highly recommended, highly beneficial for your oral cavity. So mindful chewing. You must chew your food by keeping your worries, by keeping your mobiles, by keeping your gadgets off. You should chew your each and every bite properly. You just don't need to rush to eat food. Proper nutrition can help a lot of things to get rid of. You should pay real attention to your signals of the body. If you are having any sensitivity to your tooth, if you are having any pain, you should take care. You should definitely take care of that. Just taking medicated toothpaste to take care of your sensitivities, you are suppressing your problems. You are suppressing your symptoms, but your body is giving you signals. The body is knocking you. Please work on me. Yes. Sensodyne? Yeah, that is a medicated toothpaste. So I have a hypothesis that our teeth have proprioceptors, pressure receptors under our teeth. So whenever there is particular amount of pressure that is being put on our teeth, then that pressure receptor sends signal to our brain, and they say that we are going to eat something. And our vagus nerve, that is responsible for telling our stomach to release acid in the stomach before the food comes to get best digestion. So if your teeth are not balanced properly, if the forces are not balanced properly, you might get high pressure on one tooth even when you are not eating, even when you are clenching, you are closing your jaw, if you are angry, if you are stressed, that will stimulate your vagus nerve. And that vagus nerve will release acid in your stomach. Then you will have issues of your acid in the gut. So biofunctional dentistry is definitely going to revolutionize our dentistry. So you can contact me. I am from Jalandhar, and I am done. Thank you.